Since taking office in 2015, President Muhammad Buhari has gone on about half a dozen medical trips to the United Kingdom. His first was in February 2016 when he spent 6 days outside the country. Since then, the United Kingdom has been a destination of choice for the president. That's despite a ban on foreign medical tourism for public servants. The latest trip comes at a time when resident doctors across the country are threatening to down tools on Thursday. They say they haven't been paid their salaries, allowances for months.
It's a shame that the number one citizen of this country has to travel for checkup or treatment in UK when we have abundant specialists in this country, because Nigerian Association of Resident Doctors are planning to embark on industrial strike full-blown by April 1st, 8 a.m. All those money for medical tourism can be used to develop our health facilities, to pay salaries, because we have some of our members that have been owed salary for the past 3 months. Enough is enough.
The State House Clinic, which is used by the president and his family, was recently hit by a scandal. The chief medical director complained about the lack of drugs available despite a budget of more than 4 billion naira every year. Nigeria's healthcare system has suffered from a lack of funding for decades. That's despite an agreement signed in Abuja in 1992, where governments across Africa agreed to set aside at least 15% of their budget for health. In the last 10 years, Nigeria has budgeted less than 10%.
It's totally wrong for the president of Nigeria to leave this country at this critical time when the health system is going to furtherly decay. I think at this point what the president would have done is to bring all the health stakeholders in the health sector, put them together, have a tete-a-tete with them, discuss on way forward on how to fix the healthcare system in Nigeria rather than traveling and then worsening the current ongoing situation.
It is estimated that Nigeria loses more than 400 billion naira every year because of medical tourism. That's because there is a lack of trust in the country's health system. Private and state-owned hospitals are springing up, but most Nigerians are unable to afford these facilities, leaving them at the mercy of poorly funded public hospitals.
It is quite disheartening that the President of the Federal Republic of Nigeria is leaving the country on the eve where the largest workforce of the Nigerian doctors are actually going on an industrial action. It goes to show that government has not paid priority to what it's supposed to actually pay priority to. It's quite disheartening that leadership has not actually come to the fore when it pertains to health. One of the reasons why the doctors are living in droves to Senna climbs is that there's poor remuneration, as it were, for doctors and other healthcare workers.
Nigeria has the highest maternal and infant mortality rate in the world. So, it's no surprise that politicians who travel for treatment face criticism. Health experts now want a state of emergency declared for the country's health sector. But who will put that in place when the man responsible for running the country is seeking medical attention abroad? Amaka Uday, Arise News, Abuja.